What brought me into knowing anything about disability is that I have 3 children and my eldest daughter has an intellectual disability and she's now 19. And that really brought me into a world that I was unfamiliar with before. Things that we take for granted as home, being it's about us, it reflects our personal interests and tastes, the people that we enjoy and who are close to us can come and visit whenever they like and share meals with us, and we can entertain them, getting to know your neighbours and your neighbourhood and in a fashion of sharing, so you help them and they help you, having privacy in your own personal space. All of those things, just by the nature of being a facility, can't happen. Younger people live in the community. They have supports to enable them to live in the community. And yet we have a cohort still of people who are older, who at the time were segregated in institutions because that was the norm, who are still languishing there, and yet we know that they can be supported in the community. And to me, just by the luck of the draw of when you were born, it seems a really unfair way of somebody living their life. A lot of people are really fearful that the community is not a friendly place, that the community is hostile to their loved one, or that the community is a danger even to their family member with a significant disability. But in my experience, that is not the case. Parents are fearful around the support needs of their family member, and rightly so. But to me, that's not linked to a location. That's linked to support. That's linked to good support and to well-qualified and understanding professionals that you're relying on to help manage your son or daughter's health. And that can happen just equally as well in the community as it can in an institution. Community living is about starting with the person. Who are they? Where do they belong? Where are their family? Where is their history? What are their likes and dislikes? And you build from there around where somebody should be living, location-wise, and then you bring the supports in to support them there in their whatever needs they have in relation to mobility or their medical needs and other support needs to live their lives. I think governments and policymakers and departmental staff just need to do it. We've been talking about it for years. It seems that, the majority of the view is that it's a good idea and it should be done. So it just needs to be done. That's where we're at. The talking really, as far as I'm concerned, is over. The conversation's been had infinitum. And the doing just needs to happen. I don't think the community want people to be shut in. I think the community is a different place now to what it was, and that people see that the lives of people with disabilities have value and they should be living with them in the community.